Let's talk about Trulicity. Guys, I'm Dr. Ahmet Ergin, and I have a big diabetes practice. I treat people with diet and exercise along with medications if needed, and I always want to make sure that my patients are very well informed about the possible side effects of medication. The least person you talk to is your doctor, right? So most people are intimidated from the doctors. They don't want to ask too many questions. They feel like doctor's in a rush. They don't want to bother the doctor too much. And then they get the prescription and they go home and they're like, okay, well, should I really take this? And let me just look it up. And so they end up really getting confused. Let's talk about Trulicity. So Trulicity is a medication that you take once a week. It's an injection. The good things about it is it reduces your appetite, helps your blood sugars, etc., etc. These are the good things. Now, since we are going to talk about the side effects, let's get into it before it's too late. Reading these horror stories, this and that, and half of them are true, half of them are not true. So they end up really getting confused. So if you want to take your medication with a peace of mind, and if you want to make sure that the medication is the right medication for you, and at least you want to know what to expect from the medication, I think understanding side effects and hearing from a doctor is your best bet. Now, let's talk about Trulicity. So Trulicity is a medication that you take once a week. It's an injection. The good things about it is it reduces your appetite, helps your blood sugars, etc., etc. These are the good things. Now, since we are going to talk about the side effects, let's get into it before it's too late. Okay? So the Trulicity basically will give you nausea. That is pretty much happens to at least, I would say, 80% of people in my practice. And, the thing is, the good thing about it, that the nausea tends to go away, but, it can be pretty severe too. Depending on your sensitivity to the medication, some people say, oh, it didn't even touch me, I didn't feel anything. And some people will be like, oh my God, I'm dying, I'm vomiting, and I couldn't even go to work, etc. So that's number one. Nausea is a side effect that you have to really be concerned about. Now, we're going to talk about the other side effects, but before we get there, let's talk about what to do about nausea. Do you just drop the drug, or do you do something about this nausea so you can actually continue? Because think about this. If your blood sugar, you've never seen these numbers, and suddenly you're like, oh, well, numbers are good, but I'm like really, really nauseous. Now, there are a couple of things you can do about this. Number one advice is to eat small meals. Okay, to eat small meals. Make sure you guys are not eating fatty food. So for those keto people, they may be in trouble with Trulicity. But if you're eating a lot of fat, that may be a problem, because Trulicity will slow down your absorption, will slow down your stomach, and fat also does the same thing. So as a result, any fatty food will stick around your stomach and is going to start trying to come up.
Did you know that there is a solution for diabetes, but the industry doesn't want you to know, so they can keep selling medicines? One day, when I was in the hospital, about to amputate my leg because of diabetes, I knew nothing about this deadly disease, except taking my medicine. Yet this brush with death was what forced me on the unlikely journey that traversed my type 2 diabetes and changed my life forever. Since that day, I've discovered the scientific proof that you can reverse your diabetes. The truth, according to a breakthrough American study from the University of Utah, is that the cause of diabetes is a tiny lipid molecule that makes your fat cells go haywire. This solution is as simple as consuming a blend of nutrients that target and reverse the root cause of diabetes. No matter if you are 40, 50, 60, 70, or even 80 years of age, no matter if you are a man or a woman, no matter if you've had diabetes for 10 years or 10 days, I guarantee that you can safely use this breakthrough method yourself. Check it out in the first link in the description.
And that can cause nausea. Anything that reduces the gastrointestinal sphincters, like the upper esophageal sphincter, like the spicy food or chocolate and coffee, those are the things that you may want to avoid, because again, that can just make the food come up easier, which triggers the nausea. Now, some people use ginger in their food. That's a natural remedy for nausea. Occasionally, we have to give medications like Zofran for a couple days to get rid of the nausea. And typically, you're going to get nausea in the second day. Let's say you take the injection today. Some people feel it the first day, but most people will feel it the second day because that's when the drug really peaks in your blood. Now, Trulicity half-life is around 5 days, so you may see that the effect of glucose lowering may disappear, your nausea may get better by 5 days, and then the next 2 days you're like, oh yeah, great, I feel like I'm getting used to it, and you get another shot, boom, then your levels spike again after the second day of the injection, and then suddenly you're getting the nausea again. Again, there are 2 different doses of Trulicity, 0.75 and 1.5. If the 0.5 is giving you a lot of nausea, I wouldn't just jump to the 1.5, no matter how good your sugars are getting. You just have to manage. You don't want to advance your dose before you can tolerate the lower dose. So these are tricks for the nausea. Now, what else can happen? If you have a gastrointestinal disease like gastroparesis, if you have gastroparesis, you know the term gastroparesis, like a slow gastric emptying. If you have Crohn's disease, if you have Crohn's disease, if you have ulcerative colitis or any other irritable bowel syndrome, etc., any bowel disease, if you go on Trulicity, it will definitely mess with your overall gastrointestinal system. So you may want to be careful about that and tell your doctor if you're getting prescribed Trulicity, hey, stop, I have Crohn's disease, or I have ischemic colitis, whatever you had in the past. Just make sure your doctor knows about it so that you don't have to suffer through it. Now, even if you didn't have any gastrointestinal disease, you may still have problems. You may have diarrhea or constipation, depending on the individual. Most people end up getting diarrhea, and that may not be fun, especially if you're at work and you're in meetings, etc., or you have an incontinence problem, God forbid. That may not be a very fun situation. So you may want to think about that. If your diarrhea is not getting better by a few weeks after starting the medication, talk to your doctor, think about switching your medication. I don't like to treat side effects with another medication because then the side effects keep coming up. I think there are solutions to how to manage it, and if you cannot tolerate the drug, you can't tolerate the drug. You don't have to really force. So you're going to see on the label as well that there is actually a warning about cancer. Well, that's kind of a little scary, isn't it? Yeah, so there is a warning about cancer, guys. Now, the good thing is that cancer only happened to rats. So, thankfully, none of us are rats. Now, what is the point from this? The point is, if it causes cancer in those rats, can it cause cancer in human beings? Possibly. Now, they did studies, and they didn't find any. It didn't happen to human beings. But I would say this: if you have high risk for, again, not every cancer I'm talking about here. I'm talking about pancreatic cancer and medullary thyroid cancer, which is a very specific form of thyroid cancer. We're not talking about thyroid nodules or any other thyroid cancer. We are talking about medullary thyroid cancer, and we are talking about pancreatic cancer. So if you have this in your family, as a doctor, I'll be like, look, I know you're not a rat, but let's take it cautious, because it is better to be safe than sorry. I don't want to cause any trouble. Although in a normal individual, I don't think that agent will cause any cancer, because the studies don't show it. I don't see it in my practice. Nobody sees it. Nobody reports it. So as a result, we don't see it. But the thing is, if you have a little bit of a high risk, I don't want to put fuel to the fire. Even if it's a little bit of a risk increase, I wouldn't do that. So if you have medullary thyroid cancer, again, medullary thyroid cancer or pancreatic cancer in your family, make sure you mention to your doctor, and that may be something that you should and your doctor should know. Pancreatitis is another problem. Pancreatitis is an acute inflammation of the pancreas. It is very severe. It can hurt you quite a bit. It is right in the middle, right here, and then it will go all the way back as if somebody is stabbing you. Not fun, huh? No, I don't think so. So basically, that's also going to give you nausea and vomiting, of course, So with that, I would suggest go to ER. Don't wait. If you're having this right now, stop watching. Otherwise, keep watching. So basically, so pancreatitis is a very rare complication of this medicine. There are anecdotal reports. In studies, we really don't see a discrepancy between the group taking Trulicity versus the group who does not take Trulicity. So when you look at the big scale, we don't really see differences. But still sometimes, let's say I start a patient on Trulicity, maybe 1 in a 3,000, 5,000 patients that I start Trulicity, 1 will have pancreatitis. And that is a low risk. That's a low risk. But again, if you had pancreatitis in the past, if you are prone to have pancreatitis, then I will still be cautious. I'll be like, look, you had pancreatitis before, let's just not use it. Some people want to take the risk anyways because they think it's going to help them a lot because it causes weight loss, this and that, and they like those effects. But as a doctor, my priority is your interest, your health, rather than just your weight or your sugars. Again, when we are prescribing a medication, we have to look at the entire body. I call this a holistic approach. Holistic approach doesn't mean that you treat people with grass or some herbal medicine or whatever. And I use herbal medicines too. It's just that I don't think treating holistically just means just giving herbal medicine. That's not right. Holistic means you're looking at the entire body to make sure that you're not doing anything wrong and to make sure you're giving more benefit than the harm to the patient. So that's another side effect. Now, another side effects that are not so common, but it is not so uncommon either. So like a back pain can happen occasionally. The rash can happen. Allergic reactions are not uncommon. I had a few patients come in after Trulicity, which I wasn't expecting at all, but they came up with a whole body rash. I'm like, oh, it didn't look good. I felt so bad for them. But really we just had to wait it out and we stopped the medication. But allergic reactions can happen to anyone. Thankfully, they're not common, we just have to deal with it when it happens. So it's like a traffic accidents or like anything else. Accidents can happen with anything. But if you see something, say something. If you don't expect a side effect, let's say you start Trulicity, you start having headaches. That's another one. Like a back pain or headaches can happen with Trulicity. Some people just have a mild headache or mild back pain. They'll say, I'll stick with it. It's not too bad or whatever. And some people will just not going to be able to tolerate. So when it comes to those minor side effects, I would suggest to, look at the benefits of the medication and look at how much side effects you're getting. And if it is not that bad, you can stick with the medication and see how it goes. Again, there are alternatives to Trulicity. You can try Ozempic, you can try Victoza, you can try Rybelsus. Clearly Ozempic did a study compared to Trulicity, and Ozempic was much better for weight loss and as well as A1C reduction. So Ozempic may be a preferred agent if you're especially having side effects to Trulicity. Sometimes we just prescribe Trulicity because that's the only thing insurance covers occasionally, but Ozempic also is a great drug which you can benefit from. Rybelsus is a pill form of similar to Trulicity. Again, the side effects profile kind of similar, but interestingly, when we switch people from Trulicity to Ozempic or from Trulicity to Rybelsus, people don't get the same side effects. So because there are some little differences and tweaks in those medications which make them a little bit different, their dosing is different. So as a result, as I said, it's not always a science, guys. It's kind of an art. That's what we're doing. We are trying to find the right patient for the right medication. Hopefully no medication, but sometimes we gotta do what we gotta do. And these are the most common side effects of Trulicity. I hope that this video helped you, and if it did, please make sure you give a thumbs up, make sure you share this on the social media, make sure you subscribe and turn the notification on so you can get more videos and you can be educated and you can be a diabetes pro.